back to Knee TV. I'm Dr. Adam Rosen, an orthopedic surgeon who specializes in total knee replacements. This morning I want to talk to you briefly about braces. This is one of the more common questions that I get asked by my patients. Patients will typically come into the office with a shopping bag full of braces that they bought at the store or given to by a friend or they bought online. And they really want to know, do they need to wear a brace? Do they have to wear a brace? And if they don't wear a brace, are they making their arthritis worse? Now, there are very specialized braces that I do prescribe from time to time. These are typically for ligament tears, fractures, or after very specific surgeries. But when we're talking about knee arthritis, a knee brace isn't always necessary. Now, that being said, if you buy a brace and wear a brace, and your knee feels better, that's completely fine. Some of my patients that wear braces and enjoy wearing braces when they have knee arthritis are patients that will say that when they put the brace on, their knee feels warmer, feels less stiff. That can be very common on a cold early morning if someone's going out for a walk or playing tennis or playing golf. The other person or patient that finds braces to be helpful are some of the patients that are prone to chronic swelling. So these are patients that after certain activities will have a swelling episode in their knee. And what they found over the years is that wearing a brace prior to that activity decreases the amount of swelling that they have after that activity. So for those patients, wearing the brace is completely fine. The other patient that I have will say a brace helps their stability. They say otherwise the knee feels unstable. Now, when we examine a knee, if the knee truly is unstable, it usually means the ligament is stretched, injured, or torn, and we have very specialized braces for those patients. But for most patients, what they get from the brace is what we call proprioception. You may see this commonly watching an NBA game, and some of the basketball players will have some what we call kinesiology tape on their shoulder. It helps remind them when they're shooting the ball of where their shoulder is in space. And this can happen also with the knee brace, that by putting the brace over your knee and the pressure on your skin, it makes you more aware of where your knee is in space. So you may be less likely to bend or twist or put your knee into an awkward position that could cause pain. So hopefully that clears up some of the confusion about braces. If you do have arthritis, it's not mandatory or necessary that you wear a brace if your knee is functioning well and is stable. However, if you do want to try a brace, usually the simplest brace without any metal stays that could potentially cut or scrape or injure your skin are the most helpful. Make sure the brace is fitted well and it's not too tight, as this can lead to swelling below your knee. And always check with your own personal physician based on your knee and your examination to determine whether or not that would be an option for you to try. Hopefully you found this information helpful. Thanks again for watching Knee TV. I'm Dr. Adam Rosen.